The more we learn about the so-called Affordable Care Act, the worse it gets. It should be called the Unaffordable Care Act, since cost estimates are already double or triple the estimated cost when it was passed, and federal health plans have always been lowballed on the front end. According to the Nonpartisan Congressional Research Service, Medicare was supposed to cost about $12 billion after 25 years. Instead, CRS reports that it costs almost 10 times that much, and this year will cost 6 times that amount, or over $600 billion. Premiums are going way up for most people in preparation for the requirements of the new law. The Associated Press reported on August 8th that one of the casualties of the new health care law may be paid coverage for families of people who work for small businesses. Employers are either not hiring as many workers as they ordinarily would, with many trying to stay under 50 employees so as not to be hit by the new law, or switching people to part-time work. The state of Virginia notified 10,000 part-time workers they would not be allowed to go over 30 hours a week, and some have said the new norm all over the country is 2 20-hour-a-week jobs. One leading supporter of the act was famously quoted as saying we would have to pass the law before we could find out what was in it. Now we're finding out all the promises about keeping your plan if you liked it, keeping your doctor if you liked him, and that premiums would go down by as much as $2,500 a year were all false, exaggerated, or at least incorrect. Millions have lost or will lose their coverage. Millions more are facing huge increases in their premiums. In our offices, we've helped many people with Medicare and Medicaid problems, and no one wants to see anyone denied medical care. However, before we start another program that we can't afford, we need to do more to eliminate the tremendous waste, fraud, and abuse that exists in Medicare and Medicaid today. More significantly, some people and companies have become rich off of these two programs. The administrators of Medicare and Medicaid need to crack down on those who are turning Medicare and Medicaid into monetary bonanzas. One place to start is in the huge discrepancies in charges by hospitals. A May 8th New York Times article reported that one hospital in Dallas billed Medicare $160,832 for lower joint replacements, while another just 5 miles away and on the same street billed the government an average fee of $42,000. Two hospitals in New York City varied by 321% what they charge for complicated asthma treatment, one billing an average of a little over $34,000, while the other charged an average of a little over $8,000. Columnist Charles Lane of the Washington Post wrote that Medicare reimburses power wheelchair suppliers $5,000 for a basic chair that costs the supplier $700. Just yesterday in the Oversight and Government Reform Committee, we had a hearing about the botched rollout of the Affordable Care website. Already over $600 million has been spent on this messed up, convoluted, confusing system. It's going to cost billions to straighten it out and keep updating the technology. None of this is going for actual health care. It's just going to some well-connected government contractors who are getting rich at great expense to American taxpayers. What a great law this is, destroying jobs for average Americans, but wonderful for lobbyists and government contractors. Pete Sepp of the National Taxpayers Union said, quote, "How ironic that while the Affordable Care Act is slowing job creation outside the Beltway, the law is offering plenty of job opportunities to firms inside the Beltway willing to promote it." How sad this is.